Hello everyone, I am Dr. Gaurav Garg. I am a senior consultant urologist and andrologist. I'm working in New Delhi, India. Today we are diving into a topic that a lot of men will deal with at some point in their lives, but they don't often talk about it much, and that's BPH or benign prostatic hyperplasia. Sounds complex, isn't it, right? But it simply means that the prostate gland is getting bigger, and as it grows, it can press against the urethra, making it harder to pee. Not dangerous like a cancer, but it's definitely annoying, especially at night.
Who all are at a greater risk of developing benign prostatic hyperplasia.
Number one factor is age. This is by far the biggest factor. BPH is super rare before age of 40, but by the time men hit 60, about half of them will have some symptoms. And by age of 85, the number shoots up to around 90%. So yes, aging is a major player here. Second is family history. If your dad, brother, or uncle had prostate problems, your risk goes up. Genetics matter more than most people realize when it comes to BPH. Third is lifestyle choices. Carrying extra weight, not getting much physical activity, you might be increasing your risk. Obesity and sedentary lifestyle are both linked to higher chance of developing BPH. Next comes chronic health conditions. Men with diabetes, high blood pressure, or heart disease tend to have a greater risk. It's all interconnected. Blood flow, hormones, inflammation, it affects everything, including the prostate. Next is hormonal changes. As men age, the testosterone levels naturally decline, but another hormone called dihydrotestosterone or DHT tends to rise in the prostate and it can trigger the gland to grow. Eating a lot of red meat and processed food and not enough fruits and veggies, that's also been linked to a higher risk. So, what's on your plate matters more than what you might think. And finally, some studies suggest that BPH is more common in blacks and white men and possibly a bit less common in Asian men. But lifestyle and diet probably play a role here too. So, if you or someone you care about checks a few of these boxes, maybe it's time to start paying attention. BPH is a super common disease, but the good news is it is manageable, especially if you catch it early. And remember, talking about prostate health should not be a taboo. The more we talk, the more we understand, and the better we take care of ourselves. Stay tuned. Up next, we are covering some simple lifestyle tips that could actually reduce your risk of BPH. Don't go anywhere.
What is the role of lifestyle management in such people?
Number one, get moving. Regular physical activity can help maintain hormone balance, support a healthy weight, and improve blood flow, all of which are good for prostate health. You don't need to run marathons, even a 30-minute walk each day can help. Number two, watch your weight. Being overweight, especially carrying fat around your belly, is linked to a higher risk of BPH. So, managing your weight through healthy eating and exercise is a smart move, not just for your heart, but for your prostate too. Number three, eat smart. Try to limit red meat, fried fruits, and processed snacks. Instead, focus on a diet rich in fruits, veggies, whole grains, and healthy fats like olive oil and fish. Think Mediterranean style eating is great for reducing inflammation and supporting overall health. Number four, cut back on caffeine and alcohol. Both can irritate the bladder and make urinary symptoms worse. That doesn't mean you have to cut them out completely, but moderation is key, especially if you are already experiencing symptoms. Number five, stay hydrated but smartly. Drink plenty of water during the day, but try to cut back a few hours before bed. That way, you are not waking up multiple times at night to use the bath. Number six, don't ignore the urge to go. Holding your urine for too long can strain the bladder and prostate. When you feel the urge, please go and pass urine. And lastly, get regular checkups. If you are over 50 or earlier, if you have risk factors, talk to your doctor about your prostate health. Catching changes early can lead to better outcomes and easier management. So, there you have it, small changes, big impact. You don't have to overhaul your life overnight. But adding a few of these habits can really help protect your prostate in the long run. Up next, we will talk about early warning signs of BPH, what to watch for, and when it's time to call your doctor. Don't go anywhere, we will be right back. Thank you.
Who have symptoms of benign prostatic hyperplasia but hesitate to seek treatment.
Now let's talk about something really important, the early warning signs. BPH tends to creep up slowly, and a lot of men don't realize what's happening until the symptoms start affecting their sleep, work, or daily routine. So, here's what to watch out for. First up is frequent urination. If you're heading to the bathroom way more than often than usual, especially during the day, that could be a sign your prostate is starting to put pressure on the urethra. Second, nighttime trips to the bathroom. Waking up once in a while to pee is normal, but if it is happening multiple times a night, that's something to pay attention to. It's called nocturia. It's a very common early symptom of BPH. Thirdly, a weak or a slow urine stream. If it feels like your urine flow is weaker than it used to be, or it takes longer to get started, that could be the prostate narrowing the passage. Fourth is feeling like you didn't fully empty your bladder. Even after going, you might still feel like there's some left. That's because the enlarged prostate can prevent the bladder from emptying completely. Fifth is urgency. You suddenly feel like you have to go and it's hard to hold in it. That can be frustrating and even embarrassing, but it's a common symptom. And sixth, dribbling at the end of urination. That post pee dribble might seem harmless, but if it's happening regularly, it could point to an issue with the prostate. Now, remember, these symptoms don't necessarily mean something serious, but they are worth discussing with a doctor. BPH is manageable, and there are a lot of treatment options out there from simple lifestyle tweaks to medications and even procedures in more advanced cases. But the key is catching it early. So, if something feels off, talk about it. No shame, no stigma.
What are the treatment options available for patients with benign prostatic hyperplasia?
Welcome back to the final part of today's episode, where we have been talking all about BPH, that's benign prostatic hyperplasia, or in simple terms, an enlarged prostate. Good news is there are plenty of treatments available, and many of them are non invasive. Let's break them down. First up is lifestyle and self care. For mild cases, doctors often recommend starting with lifestyle changes. These include cutting back on caffeine and alcohol, avoiding fluids before bed, staying physically active, and eating a healthier diet. Sometimes these small tweaks are enough to manage symptoms without medication. Now, next come is medications. There are two main type of medications that doctors use for BPH. So they are called alpha blockers, which help relax the muscles in your prostate and bladder neck, making it easier to urinate. The other group is 5-alpha reductase inhibitor, which actually shrink the prostate over time by affecting hormonal levels. Sometimes a combination of both is used for better results. There are some natural remedies and supplements like herbal supplements like saw, palmetto, etc. But the results are mixed and they are not regulated like prescription meds. So it's always talk to your doctor before trying anything natural. Next, if the medications don't help or symptoms are more severe, there are office-based procedures like TURP, RESM, which uses steam therapy to shrink prostate tissue, a Eurolift, a procedure that lifts and holds the enlarged prostate tissue out of the way so it no longer blocks the urethra. These procedures usually have short recovery times and don't always require hospitalization. And finally, surgery. In rare, more advanced cases, surgery might be necessary to remove part of the prostate. But this is typically a last resort when other treatments haven't worked or when complications like bladder damage may have developed. So, the bottom line is BPH is very manageable, and the earlier you get on top of it, the more options you will have. Whether it's natural remedies, medication, or modern minimally invasive procedures, there is no reason to suffer in silence. If you are noticing symptoms, don't wait. Have that conversation with your doctor. It could lead to better sleep, better bladder control, and honestly, a much better quality of life. Thank you for watching this.